What if I told you that you only have 10 seconds to save your own life if you're alone and having a heart attack? Imagine this. You're at home, relaxed, when suddenly you feel a crushing pressure in your chest. You're gasping for air, you feel like you're about to pass out, and there's no one else there. You can't call for help, you can't scream, it's just you and your heart, which is on the verge of stopping. But if you know what I'm about to show you today, you can literally survive. You can bring yourself back to life in just 10 seconds. Hello, I'm Dr. Manuel Barragán. I'm a cardiologist with over 47 years of experience treating patients with heart disease in Latin America and Spain. But today, I'm not just speaking as a doctor. I'm speaking as a heart attack survivor. 3 years ago, I had a cardiac arrest while alone at home. It felt like a sledgehammer was crushing my chest. I couldn't breathe, and my left arm started to go numb. I knew it was a heart attack, but there was no one there to help me. That's when I remembered a technique I had been teaching my patients since I was a young doctor. An emergency protocol that combines medical knowledge with physical stimulation. It wasn't a magic cure, but it gave me what I needed: time. By using it, I was able to calm the pain, breathe better, and call 911. Thanks to that, I am here today to tell my story. Since then, I've shared this protocol with hundreds of patients, and I want you to learn it too, because it could be the difference between life and death. This video is not generic medical advice. I won't just tell you to call emergency services. I'm going to show you 3 specific, step-by-step physical techniques you can apply yourself, even if you are alone, unable to speak, and your heart is already beginning to fail. Technique 1. The power cough. A hard cough might sound simple, but it's one of the most powerful tools available when your heart starts to fail. During a heart attack, a strong, controlled cough can compress your chest, electrically stimulate your heart, and in many cases, make it beat normally again. Remember what a defibrillator does. It applies a shock to reset the heart's electrical system. A powerful cough can achieve a similar effect if done correctly and at the precise moment. Here's how to do it correctly. Take a deep breath, filling at least 80% of your lungs. Feel your chest expand. Then, close your mouth and, using all the strength in your chest and abdomen, cough forcefully. It should sound like a sharp blow, not a soft, timid cough. Do this once every 2 seconds. Repeat for a minute if necessary. Even if you're short of breath, it might be very difficult at first, but it's that very pressure in your chest that can activate the heart when it starts to fail. The American Heart Association has documented that a strong cough during the first few seconds of a heart attack can increase survival rates by over 30%, and for people who are alone, it could be their only line of defense. Now, pay close attention to this detail. This technique is especially effective if you are conscious and feel the first symptoms: chest pain, shortness of breath, dizziness, numbness in your left arm, or jaw tightness. But if the pain is so intense you can't even cough, then it's time to use the second technique I'll show you in a moment. Before we continue, I want you to think, did you know this? Did you know a simple, deep cough could save your life? Most people don't, and that lack of knowledge can cost them their lives. So, if this video has already taught you something new, please consider sharing it with a family member. You never know whose life you might save. And I would appreciate it if you leave a like and subscribe to the channel. This way, we can reach more people with this life-saving message. Now, let's move on to the second technique. This is perfect for when coughing is no longer an option, a direct, physical technique many patients have used when the pain is so strong you can't even stand. Technique 2. Striking the center of the chest. When your heart is stopping and you no longer have the strength to cough, there is an even more direct and powerful resource: stimulating the heart with a precise physical impact. Hitting the very center of your chest with a closed fist can generate an electrical stimulus that temporarily restarts the heart's electrical system, just like a defibrillator, but with your own hands. Does that sound extreme? Let me tell you about Don Esteban Cordero, a 79-year-old man from Rosario, Argentina. One morning, he got up to go to the bathroom and suddenly felt a crushing pain in his chest, as if someone were sitting on him. He began to sweat coldly. His vision blurred. He tried to cough, but he no longer had the strength. He felt his consciousness fading. That's when he remembered a medical talk I gave in Argentina years ago. With great difficulty and almost no strength left, he closed his fist and struck his chest with what little energy he had. Once, twice, 3 times. On the 4th attempt, he felt a kind of internal jolt, as if his heart had been ordered to wake up. He was able to stay conscious and call 911, and the paramedics arrived in time. When he got to the hospital, the diagnosis was clear: an acute myocardial infarction. But thanks to that brave and precise action, the damage was minimal. Today, Don Esteban is doing well and says, "Hitting my chest saved my life. It was like jump-starting an engine that was dying." Now, listen carefully, because this can't be done just any way. You must apply this technique correctly. Close your fist firmly, as if you're about to hit a punching bag. Locate the center of your chest, exactly where an imaginary line between your nipples connects, right there on the sternum. Use the lower side of your fist, where your pinky is, and strike downwards with force, like you're using a hammer. Do it with a sharp, powerful blow, without fear, once per second. Repeat 5 or 6 times, no more. Hitting too much can cause injury, so do it with intention but with control. According to research conducted in Germany, 20% of cardiac arrest patients regained consciousness with this technique, and most importantly, its effectiveness is much greater if applied within the first 3 minutes of symptoms appearing. This technique works so well because a crucial pathway of the heart's electrical system passes right through the center of the chest. Striking that area can cause a reset of that system, allowing the heart to start beating with strength and regularity again. This is especially useful if you are alone and beginning to lose consciousness. Now, if this technique also fails to work in the first few seconds, you still have a third resource, one that comes from traditional Chinese medicine but has been studied and validated in modern emergency medical contexts. A technique that can help you not only during a heart attack but also when you feel chest tightness, extreme anxiety, or arrhythmias. In a moment, I'll explain exactly how to apply it and why it can help you keep your heart beating until medical help arrives. But first, remember, these techniques do not replace a defibrillator, an ambulance, or a doctor. What they do is buy you time, the time that for many is the difference between making it to the hospital or not. Now let's move on to the third and final technique. One that may seem simple, but can help you in those seconds when everything seems to be shutting down. Technique 3. The He Gu Point Stimulation. This is an ancient technique that can help stabilize your heart rhythm when all else fails, and also when you need to calm tightness, dizziness, or that feeling that your body is shutting down. The He Gu Point is located on the back of your hand between your thumb and index finger. It is used in acupressure and traditional Chinese medicine and has been recognized in clinical settings in recent years for its ability to improve circulation, regulate heart rate, and reduce physiological anxiety. How do you stimulate the He Gu Point? Look at the back of one of your hands. Find the space between your thumb and index finger. With a finger from your other hand, feel for the spot where the bones of those two fingers meet. A little further toward the index finger, there is a small indentation. That is the He Gu Point. Use your other hand's thumb to press that point firmly, just enough to feel direct pressure on the bone. Hold that pressure for 5 seconds. Then release for 2 seconds and repeat. Do this for a minute on each hand, alternating while you breathe deeply and stay calm. If you feel a slight discomfort or pain when you press, that indicates you are touching the correct spot. According to studies conducted in hospitals in China and South Korea, this point helps to stabilize heart rate, improves brain oxygenation, and can reduce blood pressure in emergency situations. And while it doesn't replace medical attention, it can give you those vital seconds to stabilize yourself while an ambulance or someone to assist you arrives. So far, you know the 3 main techniques that can make the difference between life and death if you have a heart attack while alone. Coughing forcefully to stimulate the heart from the inside. Striking the center of your chest to reset the electrical system. Pressing the He Gu Point to stabilize your heart rate and regain calm. Each of these actions can be done in less than 10 seconds, and together they form an emergency protocol that has already saved lives around the world. But before we finish, I want to give you some important precautions, because while these techniques are powerful, they must be used responsibly. And most importantly, you should always call 911 or your country's emergency number, like 123 in Colombia or 112 in Spain. These actions buy time, but they do not replace medical treatment. Now that you know the 3 techniques, I want to share some very important precautions with you, because while these methods are effective, they are not a cure, but a way to buy time until medical help arrives. Essential precautions to keep in mind. First, the most important thing is always to call 911. Do it as soon as you can, even while you are applying the techniques. Remember, These actions don't cure the heart attack, they only stabilize you. Second, if the chest pain is so intense that you feel you are going to lose consciousness, lie down immediately on the floor. Do not try to stay standing. Falling when you pass out could cause a major injury, especially to your head. Third, when applying the coughing technique, do it with force, but without overdoing it. People with fragile bones could injure themselves if they apply too much force. Do it within your physical capacity. Fourth, the strike to the center of the chest must be done in the correct zone. Do not hit too high, near the neck, or too low, on the stomach, or you could damage other organs. Fifth, even if the symptoms decrease after applying these techniques, you must go to the hospital no matter what. The relief may be temporary, and the heart attack may continue without you realizing it. Sixth, practice these techniques in advance. Rehearse where the He Gu point is, what a strong cough feels like, and how to locate the center of the chest. Because when a real emergency strikes, the mind panics, and what has been practiced is remembered. But it's not all about emergencies. The best medicine is prevention. That's why I want to give you 5 key recommendations to protect your heart starting today. Do moderate exercise every day. Walk for 30 minutes, stretch, move around. Avoid a sedentary lifestyle, especially if you're over 60. Don't smoke. Avoid excess alcohol and reduce stress. The heart is very sensitive to accumulated emotions. Avoid exercising early in the morning when your body is cold and your blood pressure is most unstable. Know the early symptoms of a heart attack. Not all of them start with chest pain. It can be shortness of breath, dizziness, cold sweats, numbness in the jaw or left arm. Never ignore these. Get regular medical checkups. An electrocardiogram or a cardiac ultrasound can detect problems before symptoms appear. And if you have risk factors like hypertension, diabetes, high cholesterol, obesity, or a family history, take it seriously, get your checkups, and take your medications. Preventing a heart attack will always be easier than surviving one. I, Dr. Manuel Barragán, now 82 years old, still walk every day. I breathe calmly and see patients in the mornings. And I'll tell you something, the heart is not cared for only with medicine. It is cared for with awareness, with attention, with small actions like watching this video, practicing these methods, and sharing them with those you love. Because hopefully you'll never have to use them, but if one day you need them, they will be in your memory and in your hands. And if a loved one collapses and you know what to do, then this knowledge will have been worth more than 1,000 books. I invite you to teach this to your family, to practice it with your partner, your children, your neighbors, to explain it as if it were a recipe for saving lives. Because it's not only useful when you're alone, it's also the noblest way to protect those around you. And don't forget one more thing, don't live in fear. Living in fear of a heart attack also hurts the heart. Live with preparation, with confidence, with intention. Always remember this, a healthy heart is not built by luck, but by habits, decisions, and prevention. Let's quickly recap. Technique 1. Cough forcefully once every 2 seconds to stimulate the heart from within. Technique 2. Strike the center of your chest 5 to 6 times like a hammer to restart the electrical system. Technique 3. Press the He Gu point between the thumb and index finger to stabilize and oxygenate the heart. All of this in less than 10 seconds. If this video helped you, I ask for 2 very simple things. Leave me a comment below telling me which of the 3 techniques you would like to practice first, or if you have already had a similar experience and would like to share it. I read every comment and I respond. Like and subscribe if you want to receive more real, reliable, and useful information for your health and that of your family. You can also activate the bell so YouTube notifies you when we upload new content like this. And most importantly, share this video. It might just be another video for you, but for someone else, it could be the video that saves their life. Thank you for staying until the end. I wish you much health and much strength. See you in the next one.